SilTact is a soft silicone contact layer designed for use as a primary dressing, helping to protect the wound bed and surrounding skin during dressing changes. Step 1. Open the procedure pack and drop it onto the work surface. Unfold the sterile field by the corners. Open the SilTact pouch and drop the dressing onto the sterile field. Use the disposal bag included to safely arrange your pack contents. Step 2. Once the previous dressing has been removed, cleanse the wound in accordance with local trust policy. After, gently pat the surrounding skin dry. Step 3. Carefully peel back the longer side of the paper backing to reveal the adhesive surface and create a side flap to help with the placement of the dressing. Step 4. Position the dressing over the wound, ensuring a 2 cm overlap onto the surrounding skin, and gently remove the remaining backing while smoothing down the dressing to secure in place. Step 5. Once in place, apply a secondary dressing such as an absorbent pad to absorb any fluid or exudate. Step 6. Secure the secondary dressing with a suitable securement aid, such as a retention bandage or surgical tape. SilTact can stay in place for up to 14 days, depending on the exudate level and condition of the wound. SilTact,